It costs next to nothing. It's in every medicine cabinet. And it's still called the drug of the century. But do you know that aspirin can cause internal bleeding, destroy your stomach, and even trigger a stroke? Why is this simple drug included in the list of essential medicines, and at the same time considered potentially deadly? Let's break it all down. No myths, just facts. What is aspirin? Active ingredient, acetyl salicylic acid. One of the oldest medications, first synthesized in 1897. Aspirin has antipyretic, fever-reducing effect, analgesic, pain-relieving effect, anti-inflammatory effect, and most importantly, antiplatelet effect. It thins the blood. Where does it save lives? Aspirin is prescribed in low doses to prevent heart attacks, strokes, blood clots, thrombosis. It's part of standard therapy for patients with coronary artery disease, a history of heart attacks, stents, and bypass grafts. When used correctly, it can reduce the risk of recurrent heart attack by 25%. But how can it be dangerous? 1. Bleeding. Aspirin can cause gastrointestinal bleeding, especially in older adults or during long-term use. Even low doses, 75,100 milligrams, can damage the stomach lining. 2. Reye syndrome. In children, taking aspirin during viral infections in children can lead to Reye syndrome, a rare but deadly complication. It causes severe liver and brain damage with a high fatality rate. That's why aspirin is strictly forbidden for children. 3. Allergic reactions and asthma. It can provoke bronchospasm in people with aspirin-induced asthma. Possible reactions include skin rashes, swelling, angioedema, and even anaphylaxis. 4. Dangerous during pregnancy, especially in the second and third trimester. Aspirin may interfere with fetal development and cause complications during labor. Interesting and little-known facts. In the 1950s, aspirin was officially entered into the Guinness World Records as the most widely used drug in the world. Its derivatives, such as Thrombo ASS and Cardiomagnyl, are just as popular but carry the same risks. Acetyl salicylic acid was originally synthesized from willow bark, which contains salicin, a natural aspirin-like compound. In ancient times, people chewed willow bark, and it really did help with pain and fever. When is aspirin necessary, and when is it not? Aspirin is indicated after a heart attack or stroke, for angina, chest pain due to poor blood flow, if you have stents, bypasses, or atrial fibrillation. Sometimes, in COVID-19 patients at high risk of blood clots, under medical supervision, aspirin is not needed for general prevention without proven cardiovascular risk. For pain and fever, safer alternatives like paracetamol or ibuprofen are preferred for children and teenagers under 16 years old. Conclusion: aspirin is not a magic pill. It's a powerful tool that can save lives, but also cause serious harm. The key is proper use under medical supervision. It's survived over 100 years on the market, found its way into every medicine cabinet in the world, and it still has the power to surprise and to frighten. That's aspirin.